Some 10% of Jamaica's population, or 250,000 Jamaicans, have a physical or mental disabling condition, according to the Jamaica Council for Persons with Disabilities. It is also estimated that 8.6% of Jamaican women and 9.9% of Jamaican men in the reproductive age group 15 to 49 have some form of disability. Globally, persons with disabilities are among the disenfranchised groups who have tended to fare worst in terms of having their rights, and especially their reproductive rights, respected. At the 1994 International Conference on Population and Development, ICPD, 179 countries, including Jamaica, affirmed the centrality of reproductive rights to development. The resultant ICPD Program of Action and the Millennium Development Goals specifically identified persons with disabilities among those whose needs demanded urgent governmental action to ensure non-discrimination and their participation in all aspects of life. In Jamaica, as in many other parts of the world, ignorance has led to a form of discrimination against the disabled, particularly in the exercise of their sexual and reproductive rights.
The fact that there has been stigma associated with the disabled over the years is a battle that we will have to fight on an ongoing and sustained basis. I've been told of stories that persons with disability go to pharmacies to check and see if they can get their condoms or other forms of contraceptive. And when they do, I mean, they are looked at in a particular way, you know. And because of that, a lot of disabled persons don't go to the pharmacy to get contraceptive devices. And when that happens, you can understand how unsafe it is in their sexual practices.
Persons who are providers of services, to a large extent, I think, do not have the knowledge about, disability issues. And so a lot of what they think is based on what is, the rest of society believes. So they tend to group everybody in one, basket. They shouldn't, first of all, be in relationships that are sexual in nature. And then secondly, to talk about having children. Now, that's an additional burden on society.
Much of these perceptions and attitudes towards disabled persons have been confirmed by the background research carried out as part of the Government of Jamaica EC UNFPA Sexual and Reproductive Health Project. The SRH project, which was launched in November 2003, is being executed through the National Family Planning Board. Its goal is to improve the quality of life for underserved segments of the population. The specific outputs are increased awareness of sexual and reproductive health issues and rights among adolescents, men, and persons with disabilities. Increased institutional capacity to provide greater access to and delivery of high-quality sexual and reproductive health services.
This particular venture is geared towards sensitizing and also generating public consciousness as it relates to the rights of persons with disabilities, and we as an administration, as a government, is extremely supportive of the venture.
Along with the National Family Planning Board, several local agencies are integrally involved as partners in the project. The Government of Jamaica EC UNFPA Sexual and Reproductive Health Project is being implemented in 3 phases. Research at the initial stage that informed the development of a social marketing plan, and actual development of information, education and communication IEC materials for training and sensitization. While the agencies collaborate and work very closely, sharing information throughout the project, each of them has specific responsibilities. The research sought to gather information about the knowledge, values, attitudes and practices of adolescents regarding sexual and reproductive health. This aspect of the project was coordinated mainly through the Jamaican Association on Mental Retardation, JAMR.
The challenge really was moving across the island to get the various groups to participate in the study itself. It was qualitative in nature. The idea behind this research really was to utilize a special methodology because we recognize that talking to adolescents with disabilities in particular groups, to just sit around a table talking to them, you may not be able to get the information that you need. So the idea to use a particular methodology that is participative in nature, that gave the adolescents the ability to be at ease and to just talk.
It was new ground we were breaking. There was no precedent set in terms of researching sexual and reproductive health issues with the disability sector in Jamaica, and for that matter, the Caribbean. So we worked as a group, brainstorming our methodology, trying to translate mainstream techniques into our context. And that allowed a very rich experience, both with agency staff and persons in the disability sector.
In addition to discussions, the research team facilitators used various images, body mapping, diagrams and drawings to facilitate the research process.
The group that facilitated the deaf adolescents were themselves deaf. These adolescents went through a series of training programs that really sought to getting them comfortable with the methodology, comfortable with the approach that is what was going to be used, so that they'd be able to conduct the focus group discussions in a very confident way.
That we think we feel very proud of as an output from the project. Not just that we got information that was valid and that can stand up to scrutiny, but also that those young persons who helped to facilitate the process became richer in terms of their knowledge of reproductive health. And so we have a rich cadre of persons now who we can call on as peer counselors, and we hope some of them will go on to formal training as guidance counselors.
Zandria Peterson and Christopher Civil were two of the young facilitators.
It was really inspiring this project. I traveled over the island and I did interview and assessment, and I realized that some of these persons I knew and some I didn't know. This was really an inspiring project. We used charts to identify parts of the male body and the female body. We show how the breast grew during puberty. We showed pictures of different things, like how hair grows under the arm and different things that happen to the body. For example, this is a chart that we had used. We had parts of the male body and parts of the woman's body. We had the penis and the vagina. And this is a picture of a teenage woman growing up, teenager growing up, how her breast matures.
Some of the deaf that we spoke with were apprehensive. Some said they learned from TV, some learned from adults in their community, while others learned from their parents. Some of the experiences that they related to me, I realized that I had these same experiences as I was growing. To show you, this is one of the diagrams that we used in the project in interacting with the deaf. This shows the development of the body. For example, how the facial features change as you grow, hair on the face and so forth. If there is no parental influence, then problems can pop up. So we encourage especially the boys to make use of contraceptives, and encourage the parents that they need to teach the children as they grow. For example, while I was growing, didn't have a father.
The research carried out among adolescents with disabilities indicated that there were significant gaps in the information they had about reproductive health services, many myths surrounding the knowledge they have of contraceptives, unfriendly healthcare services. Many persons lack knowledge regarding their reproductive health rights. Parents, while having some knowledge about sexual and reproductive health, are afraid of sharing this knowledge because they do not know how to share this kind of information with their children.
I think in real terms, the needs of adolescents with disabilities are the very same as non-disabled adolescents. And so most of our parents recognize this. But the challenge that they faced was how to communicate this information to their adolescent who might have depressed intellectual capacity or needed to learn through an alternative mode. So for example, a parent with a deaf child or deaf adolescent, the challenge for them was, how do I express the depth and breadth of information that I would share with my hearing child, with my deaf child, if I don't have the communication skills? So this was what they laid on the table. They want to be a part of the process, but they don't have the fluency in sign language to express it. And then there were no available resources that they could lean on.
Macam Child Development Center has been working directly with the service providers. These include the medical profession, nurses, doctors, health educators, social workers, school nurses, and guidance counselors.
It's been a very demanding project, much more so that I think that we thought we would, be to begin with. Because you were always conscious of the fact that it's something that is going to be replicated, and you're being reminded of that all along. What we saw to a large extent is that the people who are the professionals out there, two things I would think. One, a lot of them have no real formal training in dealing with persons with disabilities. But I also found that there were some persons who had a pretty good idea of what the needs were and were trying to do what they could. Like, for example, when I spoke to the nurses, I found that a lot of them were trying to cope with the situation.
The sensitization program for the service providers has already begun through presentations at professional conferences and seminars. A training manual is also being developed for this group. The Women's Center Foundation of Jamaica has focused more on working with males, both disabled and non-disabled.
Our perception of disabled was just one as a group. But when we worked through this project, we learned a lot, and we recognized the differences within the group. We also recognized from our needs assessment with those men in those groups, the gaps that were there in terms of what we were producing, imparting to them in terms of reproductive and sexual health, that there was hardly anything. And if anything was there, it was very negative. This was also for our able-bodied men, not just the disabled. Then when we have to do those need assessment workshops and those training groups that would involve any disabled person, we were challenged to find suitable locations. The places that we would normally have workshops have no entry, no access for the disabled persons. There were no toilet facilities for them to use because anybody in a wheelchair couldn't get into some of these spaces. So, we learned a lot because we realized that these are things that we able-bodied people take for granted every day.
Lakeisha, Patsy, you in there?
Much of the information, education and communication (IEC) materials like this comic book series that is now being disseminated, was developed based on needs expressed, the communication formats preferred, and recommendations that came from the primary target groups.
My body is my body.
This large print version is geared towards persons who are visually impaired but not blind. Audio CDs featuring the same stories are also produced for blind persons. A series of posters featuring messages directed to specific groups has also been created. This flip chart is developed as a teaching aid for guidance counselors.
Guidance counselor assures us that this can use with a group of about 15. Some people can stretch it a little bit differently according to how you seat your group. So you, my student, would be seeing this, but I would be seeing this part as a guidance counselor. So I have some information here that will allow me to give you accurate factual information. I have some areas that we can have discussions if we want to, and we have some actions that we can take. So we can use this. I can give you the information. In the event that, okay, yes, I can't recall, I can look here while I'm speaking to you and you are looking at this. I'm speaking to you about the changes that are taking place in your bodies as you grow.
Welcome. We have been expecting you. You think you have been brought here by chance or adventure, but today you will face your destiny. You have been chosen to face the 7 masters.
The Jamaica Association for the Deaf is particularly pleased about this interactive computer game.
We have been able to design a script that allows for superficial or a very simple interaction with the game for those depending on their intellectual level or age, and yet the same product can allow very deep intellectual discussion because the characters in the game are all symbolic, and the final stage of the game allows the player to interact with life experiences and work through the process of making choices and seeing the consequences.
The game is called the Master of Life, and it's a quiz game. There are tasks and missions for you to accomplish, but the quizzes where you're asked questions on sexual and reproductive health are the ways from which you earn money or earn items that will allow you to advance through the game. A lot of interesting characters, lots of interesting gameplay, from mazes to buried treasure games, villains, good people, bad people, and it's a fun game.
The drug window at the Jamaica Council for Persons with Disabilities is another example of how the EC UNFPA project is strengthening the capacity of the partner agencies to increase access for disabled persons to relevant SRH services.
This drug window and the outreach provides that opportunity for persons with disabilities to be served, for their needs in this area to be met, and for them to be comfortable speaking with somebody that they are familiar with, in terms of their sexual and reproductive health issues.
There's still some amount of hesitancy on the part of persons to come to this centralized location. So, the outreach program that was recently established is a welcome addition to this service.
We have a vehicle that was donated by the UNFPA, European Commission, a project, and we use that to do the distribution, not only of the condoms, I may say, but posters as well. What we do is through the contact that the person that we trained earlier with the National Family Planning Board in counseling and this, contraceptive or sexual and reproductive health issues, through that individual or those individuals, we find out how many clients they serve and how many, they would want in terms of condoms and pills, and then we distribute. And they would do the counseling and distribution from their center.
The JAMR School of Hope is another partner agency and affiliate institution that's already feeling the positive impact of capacity strengthening through the SRH project.
We are faced with the crisis of sexual abuse very often, and we have not been in a position to put in preventative measures. So basically we are just reacting to crisis after crisis. So you can well imagine how welcome this project is to enhance the work that we do. It will go a far way in terms of preparing our students, parents as well, either to be able to deal with students who may have questions, or basically to inform their behavior in terms of sexual choices.
The partner agencies are all lauding the networking benefits of the project.
We've had to work so closely, so we are understanding much better the issues that have to do with the deaf or have to do with, persons with mental retardation or whatever. It's bringing new awareness, even among those of us who already work in the disability sector.
I think it has been very rewarding. We have maintained a very participative approach throughout the entire implementation process, and we have gotten so much out of that. We worked at specific objectives, but there were some other byproducts in that sharing of our respective expertise helped to build each other. So that is a benefit that perhaps we didn't bargain on, but it's something we can celebrate.
No project before has really targeted the disabled persons or persons with disability in this way. There were many groups working with disabled persons, but there was an absence of coordination. This project has helped to strengthen that coordination. It has helped to focus everybody on the needs and rights of disabled persons, especially their sexual and reproductive rights. For the first time, disabled persons now have materials developed and designed specifically for them with their inputs, which relates to their needs and their desires, respecting very much their rights. For the first time, we have had the participation of non-disabled persons working closely with disabled persons in designing programs and materials for them, and we can celebrate that. For us at UNFPA, identifying persons with disabilities as a target group was very easy, because we have been mandated to look at the most disadvantaged groups. And in any respect, persons with disability are the ones that has their rights most violated. So they had to be a target group. And the ICPD process, the International Conference on Population and Development, was clear in Section 6 about what should be done and what government should do in facilitating the reproductive rights of the persons with disability. And to this end, we are facilitating that process by strengthening the capacity of both the coordinating agency, the Jamaica Council of Persons with Disabilities, and the monitoring and implementation capacity of the other partners working with them.
And Christine Hendricks from the Jamaica Council for Persons with Disabilities is anxiously awaiting the next phase of the project that will seek to target the wider public.
Getting people to understand that persons with disabilities are regular human beings, sexual beings created just like them. It is only an understanding of this that can change, the public's view of persons with disabilities as it pertains to this topic. And that is the reason the next aspect of this project is taking the information out on the streets. First of all, empowering persons with disabilities to know that it is their right, to express their sexuality and be comfortable doing so.
Responses to both the sensitization programs and the IEC materials so far are clear indicators that the project is already making a difference among the various target groups.
I felt inspired.
The partner agencies are clearly enthusiastic and have all expressed commitment to bringing about a shift in the way society views persons with disabilities.